I'm being joined this morning by Minister Shandro, Dr. Hinshaw, and Dr. Vernayu, who are joining us today because COVID-19 is surging once again in Alberta. As it is everywhere across the country and most of the world, the Delta variant of COVID-19 is causing concerning rises in hospitalizations in our province, almost entirely amongst unvaccinated Albertans. COVID-19 vaccines continue to provide amazing protection against infection and severe disease, even with the Delta variant. So I'd like to thank the 2.9 million Albertans who have chosen to roll up their sleeves. Yesterday, we reached the critical milestone of having 70% of our eligible population fully vaccinated. That's to say 70% of Albertans aged 12 and over. 78% of eligible Albertans have received at least a first dose. This is an important achievement, especially when you consider that Alberta has Canada's youngest population. But the bad news is that we still have 30% of the eligible population without full vaccine protection, that is to say without 2 doses. And the Delta variant is ripping its way through this group at an aggressive rate. When we lifted restrictions on July the 1st as part of our Open for Summer plan, the Delta variant was actually in decline in Alberta. We proceeded with that plan based on our Chief Medical Officer's analysis of data from countries like the United Kingdom that showed that while Delta did cause a spike in cases, it did not have a dramatic impact on severe outcomes leading to hospitalizations and deaths. In effect, cases and severe outcomes had become increasingly decoupled. Unfortunately, this has not been Alberta's experience at the population level. Vaccines do decouple individuals, I should say, from severe outcomes dramatically on an individual level. But because of the large group of people who have no vaccine protection, we have seen the Delta variant spread widely and cause severe outcomes at much greater rates in unvaccinated adults. This is true even amongst younger adults. As an example, since July the 1st, unvaccinated people between the ages of 20 to 59 have had 50 to 60 times higher risk of hospitalization than those who are vaccinated. Let me just repeat that. People between 20 and 59 who are not vaccinated have 50 to 60 times greater chance of hospitalization than those who are fully vaccinated. Overall, unvaccinated people have made up more than 80% of all hospital admissions since July the 1st. And since August the 1st, we've seen a steady increase in the number of COVID-19 patients in hospital in both ICU and non-ICU, with a rapid acceleration in the past week. On August 24th, we had 243 non-ICU patients in hospital. But on September the 1st, just 8 days later, we had 373, an increase of 54%. The intensive care situation is even more serious. On August 24th, there were 59 COVID patients in intensive care, and on September the 1st, there were 114. That's a 93% jump. But the vaccination status of the patients behind these numbers tells the real story. Of the 373 non-intensive care patients in hospital, 80% of them are unvaccinated. Of the 114 in intensive care, it's over 91% unvaccinated. So please get vaccinated. These numbers say it better than anybody ever could. The reality is that we as a government don't get to choose how the virus behaves or how many people choose to protect themselves against it. We just have to find a way of limiting the damage that it causes, especially to our healthcare system. The bottom line is this: 4 out of 5 Alberta adults have protected themselves and helped reduce transmission by getting vaccinated. But 1 out of 5 Alberta adults have not. And their choices are now jeopardizing our healthcare system. So I'm going to be blunt. If you are unvaccinated, it is urgent that you protect yourself, our hospitals, and our entire community by getting the benefit of this miracle of modern medicine as soon as possible. If you have received only one dose, please step forward for your second dose, which provides powerful additional protection. What are you waiting for? You've already had the first dose. Please step forward for that second dose. If you have concerns about the safety of the vaccines, please speak to your medical doctor or pharmacist. And if you just haven't gotten around to it, for the love of God, please get vaccinated now. And if you do, we will now pay you $100. Today, we are announcing that Alberta will be the first province to offer a personal monetary incentive to step up and do the right thing. Anyone who gets a first or second dose will now be eligible to receive a $100 gift card. Minister Shandro will provide details in a moment. Over the last 2 days, the COVID Cabinet Committee has received advice from officials in Alberta Health Services and Alberta Health, including Dr. Hinshaw, and has decided on a course of action to do just that. And Dr. Hinshaw will share case growth and hospitalization modeling in a moment. I know all of this is frustrating to hear right now. Many of you had hoped we were done with the severe waves of COVID-19 that test the capacity of our healthcare system. Goodness knows that includes me. To parents, I know you're feeling some anxiety as this fourth wave rises and vaccines remain unavailable to kids under the age of 12. But please know that our back-to-school plan is in full accordance with the Chief Medical Officer's recommendations, and who continues to watch the situation very closely. And as we know, COVID poses a less severe risk to the health of younger children than the regular flu, and than many other health risks. To seniors in congregate care and the immunocompromised, please know you are now eligible for a third booster dose. With the Delta wave surging, I urge you to please book that third dose to strengthen your level of protection based on what we've learned in other places like Israel. My final message is to those of you, once again, who have not chosen the vaccine. As the numbers shared earlier clearly show, this is essentially now a crisis of the unvaccinated. The overwhelming majority of severe cases and outcomes that are putting pressure on our hospitals are occurring in unvaccinated patients. Unvaccinated people are about, as I said, in those age ranges, 50 to 60 times more likely to be hospitalized than those who have the protection. So you are putting yourself at risk, and you're putting our healthcare system at risk. Your decision does not just affect you, it affects more than you. Today, Dr. Yu is going to be announcing surgery postponements in various parts of the province. That is a direct result of the pressure in the healthcare system coming from people who have chosen not to be vaccinated. Your personal choice has very real world social consequences. Before I close, I'll say that this wave, like the others before it, will come to an end. And unfortunately, there will be waves to follow it. We still must learn to live with COVID-19 in a way that is as close to pre-pandemic normal as possible. That remains this government's overall goal in responding to the virus. Some waves will be worse than others, but how much worse is still up to all of us.